Just recently, I walked into a situation. Don't ask me why. I can take you through what was going through my head. I'd never done it before. And for some reason, I think it was because I must have been really tired and I had to stay awake after traveling. And so I needed something that would keep me stimulated. And so I walked into a nightmare. So I'll tell you what happened. Essentially, I've been thinking for some time that we really need to find a way to understand how it is that we can interact between the two sides of what's happening with COVID. You have on one side, you have pro-vaxxers, on the other side, you have anti-vaxxers. I think I'm in the middle in that I'm neither pro nor anti. I can see where there's benefit, I can see where there's risk. And most concerningly for me is that while everybody's arguing about one side or the other, in the middle are a lot of people getting sick. And we need to figure out why. And so, what needs to happen is we need to have scientific discussion, not necessarily debate. So, follow what happened. I happened to be on X at the time, Twitter, and I stumbled into this page. Now, this is Ian Copeland. He hosts a number of spaces. He's a strong pro-vax advocate, and I appreciate the time that he gave me to talk. And similar to what you can see here on the right, his conversation popped up in front of me. And so, it was this one here: vaccines cause more harm than good. Explain. And as I was thinking quite naively, I thought to myself, you know what? I think this is an opportunity to try and discuss some of the issues that are happening across the population. And my view is that I'm very concerned that many people don't understand that the issues that were not adequately addressed during the COVID pandemic, especially around the efficacy and what has happened with regards to COVID vaccines, are adversely affecting the perception of all vaccines. I think that is a huge risk. And if we don't have any transparency, any accountability, any honesty, this problem is going to be compounded. And you can see what's happening in Texas with the measles outbreak now. A lot of parents are holding back with regards to their children being vaccinated against measles. And you can almost see, you could predict this was going to happen because so many people have lost faith in the system. So the question becomes, how do we try and re engage those discussions? How do we try and get back to the science to try and address some of these problems? So when I entered, I genuinely was just making one point. I was just raising that issue that actually, in when we look at what has happened in terms of the COVID pandemic, a lot of trust has been damaged, rightly or wrongly, people may argue. Um, and this is impacting not just vaccines, but general health and the approach to health across the population. And I then ended up in probably an hour and a half discussion, and the link is in the description below if you want to listen. I was probably at about the hour mark where I happened to stumble into it. And straight away, and this is where I said that I'm not really trying to debate many of these issues, I'm trying to discuss them because I'm trying to understand what other people are seeing, and I'm trying to explain, okay, well, here is what I'm thinking about. Here is what. And so the first thing is that I got caught out with the fact that straight away they looked through all my feed. I can't imagine how much is in my feed. And they must have scrolled through about 5 months because what they picked on was a discussion I had about nanobots. So, to give you context, this was a discussion that I had. It was a paper that I had seen, and so many people were talking about it from a scientific point of view. My view is that there is nothing off limits in science. You can discuss anything, you can address anything. If there are questions, you look at it, you try and deal with it in an open and clear form, in a way. So this paper was talking and making reference to that. And so that's what they picked. For one, they didn't think there was a paper, but there was. So I had to go and look for it. And then I'd say, well, there's a paper here. Then they started to tear apart the paper. My view is, well, I didn't write the paper. I'm saying this is a peer reviewed paper and it has raised some important points. But you can imagine that just takes you far away from where the discussion should be going, which is around what is happening with regards to trust in vaccines and health generally. I'm not sure what the answer is because I think for many people, this is about winning a debate. As I said, and it's on both sides. So, in the context of people who are completely against the vaccine, their aim is to win an argument that they were right. I'm saying we've got to move beyond that. It doesn't matter whether you were right or you were wrong. We are currently in a horrific situation because we have a virus that is exceptionally good at suppressing immunity, circulating avidly across populations. And even though people don't like me saying it, it is an observational fact that it is circulating, it appears, in highly vaccinated populations. Now, people say it's circulating everywhere. And I keep on saying we don't have any epidemiological evidence that says that it's circulating like this in Papua New Guinea, which is, say, 5% vaccinated. And if it isn't, you then have to ask why. And if you look at it and you find that it's because that population has natural immunity and maybe something else, by exploring the science, you would then understand what are the mechanisms. But that's where we are at the moment with regards to addressing some of these things. I think that just to give you a flavor as to what was in that discussion there, I will let you hear what it sounds like in the discussion.
No, good. No, this is good. This is good. Give us the study that shows us their net. You said it's published, so it's too late now for you now. You can't back out now. Give
Yeah,
us the
yeah, yeah,
study.
yeah.
Give us the study.
Okay,
Let's do
you
it.
want me to find the study? Give me
Yes,
a
sir.
second, because
Uh huh.
I have all these things
Okay,
listed
good.
somewhere.
Then it should be easy to
So,
find.
yeah, yeah, yeah. So keep asking me questions while
No,
I
no, no, no,
find
no,
that
no,
for
no.
you.
I'll wait. No, no, I'll wait. It should be. There's never.
So, as you can see, luckily for me, I have 54 pages of papers that I collected since 2020, where I can relatively easily find some of the papers that stood out to me. But it was still quite hard work. I wasn't prepared for that. That's the truth. I hadn't been prepared for that kind of questioning. I was just going in to make a point. But it raises that issue. And just because I think I got cut off at the end, because somebody was genuinely upset with me, just in case they're listening again. And they were saying that as a doctor, I have a responsibility to support the science and to encourage people to do the right thing. Now, that person, I think, is older, had comorbidities, and they would be in the cohort that I would have said, even at any point, should therefore have been vaccinated, because the high risk cohorts were the ones who had the risk of severe disease. My perspective, though, is that you don't vaccinate people who have already had the infection, because if you understand how the virus causes severe COVID 19, unless somebody has a weak immune system or something like interferon autoantibodies, you're unlikely to get severe disease with COVID. So if somebody previously had exposure, they are most likely going to be fine. Not absolutely, but most likely. And so, therefore, my view was that if you had a cohort of the population who was naive to the virus, were at high risk, then any intervention to try and reduce that risk was worth it. And that's where I still stand today. And I think that the huge mistake was that they went for the whole population, thinking, in flawed thinking, that the vaccine would stop circulation of the virus. And I mean, if you looked at the science at the time, it was pretty clear that it was about preventing severe disease, not stopping circulation of the virus, because it can't stimulate effectively mucosal immunity. So it's that kind of thing that you have. And that's where I think that we have a situation where it's almost a standoff. And I know that most of my audience is probably on the against side. But you have to remember that much of your family and friends could be on the pro side. And then you have a huge cohort of people who are extremely confused, who followed along and now are no longer following along, and they're kind of stuck in the middle. They don't know what to do. They're concerned about health. They are a little bit lost. And what they don't want is somebody coming in front of them and saying, I told you so. That's like the worst thing to say. So we have a huge problem ahead of us trying to address some of these things. However, I do think that for the fact that I walked into that, what felt like an ambush, talking about all these papers and p-values and so on, I'm thinking, well, I'm a clinician. I'm more interested in trying to understand how people get sick and, what is the relevance of the science. But the point is that we have to move beyond the debates. We have to now start to move with an openness of reflecting carefully on the science. And the science sometimes shows you things that you didn't expect. Say, for instance, I'll show a paper soon where it is looking at cardiovascular or the atherosclerotic plaques. And it was interesting to note that in the vaccinated cohort who didn't have an infection, it seemed as though it slowed the progression of those plaques. But if they had an infection, it made it worse. It's that kind of nuance that we're seeing. And I think that the bigger question is not that it happens, but why does it happen? What is the mechanism? Because if you have that kind of mechanism occurring, is it a short-term effect? Do you then have a rebound change in the longer term? My suspicion is that's related to IgG4. And we know if it's IgG4 levels, which is the tolerant antibody, it's going to fall over time. What happens when the levels fall? Is it that the person returns to a normal state, or do they end up in a situation where there's a rebound, where they actually have worse progression down the line? These are all very, very important questions, things that need to be addressed, but it needs discussion. It needs nuance. It needs thought. It needs openness. It needs humility. It needs an ability to listen and to reflect carefully on what we're trying to achieve. At the end of the day, as I said, in the middle are real people. A lot of them are sick. And based on what I see with the science, a lot more people are going to get sick if we don't figure out how to mitigate the impact of ongoing circulation of this virus. Part of that process is, as I said, if you haven't joined, I'm talking about what's happening in India with Guillain-Barré syndrome, and I'm tying it in to what is probably happening in different parts of the world. And what's interesting, as I put this together, you'll find this in the link below. As I put this together, you start to see that in every region, there is a predisposition. Say, for instance, in Texas, the predisposition or the weak spot may be to do with something like measles. And this is why we were seeing a flare up there. And if you don't look carefully and in a nuanced way at what is happening, you may superficially think that this is just because of an unvaccinated cohort. The question would be, that's broadly across the country. Why would it happen in that region? Now, in truth, this is probably tied to a specific community who has a very high or very low vaccination rate for measles, and that probably is the primary reason. But the point is that anytime you see an unusual pattern, we need to look carefully and try and make sure that it is not connected in some way, shape, or form with COVID. So, as a final point, in case Ian watches this, Just say thank you again for giving me the chance to speak at the time. Just in case I come again, I'll come with lots more papers and p-values to talk about the statistics. But my view is that we need discussion, not debate at this point. Thank you all very much for listening. Have a great evening.